Your cervix does something extraordinary once a month that most women have never been taught about. It opens, it changes texture, it literally shifts position inside your body. And it's doing all of this to communicate with you. Yet, most women find out their cervix exists for the first time at a pap smear. This is a failure of education, not yours. Today, we are fixing that. Today, we're diving deep into the cervix, what it actually is, what it's doing throughout your cycle, and what it tells you about your fertility and what changes that you should never ignore. We have 4 studies we're pulling in for today, and I'll flag each one when we get there. Let's go. Hello and welcome to The Midwife Says. My name is Melanie and I am almost licensed midwife in the state of Florida. Here I share evidence-based facts about women's health, pregnancy, birth, and postpartum. Your cervix is a lower portion of your uterus, a cylindrical structure about 3 to 4 centimeters long that connects the uterine cavity to the vaginal canal. It is not passive. Throughout your menstrual cycle, your cervix is actively responding to hormonal signals, and those responses are measurable and observable. Here is what's happening in real time. During your menstrual phase, the cervical os, the tiny opening, widens slightly to allow menstrual blood to flow out. The cervix sits lower in the vaginal canal and feels firmer, more like the tip of your nose. During your follicular phase, as estrogen begins to rise, the cervix starts producing a different kind of mucus. Estrogen is essentially signaling we might be approaching ovulation. Let's get ready. The cervix begins moving higher. At ovulation, this is where it gets remarkable. Under peak estrogen influence, the cervix reaches its highest position, softens slightly, more like the texture of your lips rather than your nose, and it opens slightly. The mucus it produces becomes clear, stretchy, and slippery, what we call egg white cervical mucus. This is specifically designed to help sperm survive and travel. After ovulation, progesterone takes over. The cervix drops, firms back up, and produces thick, tacky mucus that creates a barrier, a plug, making the uterine environment inhospitable to sperm. Study number 1. A 2003 systematic review in Human Reproduction Update by Eggert Cruz confirmed that cervical mucus characteristics are directly tied to fertility outcomes, and that the hostile cervical environment post-ovulation is a significant biological barrier. Your body is not malfunctioning. It is an exquisitely timed system. If you've ever tracked your cervical mucus, I want you to understand what you've been missing. Not to shame you, but because this is your data living in your own body, available for free every single day. A 2010 study published in the Journal of Obstetrics and Gynecology Canada found that women properly trained in mucus observation could identify their fertile window with accuracy comparable to hormonal testing. What you're looking for, dry, means low fertility. Sticky, tachus, means your cycle is building. Creamy white or yellow mucus means fertility is rising. And egg white mucus, clear, stretchy, pulls an inch or more without breaking, that is your peak fertility window. If you're interested in any products to help you with that, I'll talk about a few here. And let me be clear, they did not reach out to me to talk about these products. These are products I sought out because I truly believe in them. So you can add in LH ovulation strips. I link the one faux ovulation test strips in the description. They're consistently one of the top selling, best reviewed strips on Amazon. And they're affordable enough to test every single day during your fertile window. If you're never seeing egg white mucus, that's clinically meaningful. It can indicate low estrogen and ovulatory cycles or nutritional gaps. That data is worth bringing to your provider. Beyond mucus, there is a second pillar of literacy that I want every woman watching this to know about. Your basal body temperature. After ovulation, progesterone causes a distinct, sustained rise in your resting temperature, typically 0.2 to 0.5 degrees Celsius. It's subtle enough that a regular fever thermometer will miss it. You need a basal body thermometer, which reads to the 100th of a degree. Taking your temperature before you even sit up in bed each morning over time gives you a clear chart of when ovulation occurred and whether you had a healthy luteal phase. So here is the second product that I'm recommending, which is the Thermometer Smart Basal Thermometer. This one auto syncs via Bluetooth to the app, so you don't have to deal with any data entry. And this one is consistently rated 4.5 stars. Again, I sought these products out because I genuinely believe that they can help you take charge of your own health. I'm not being asked to share these products at all. So if you want the Cadillac of wearable BBT tracking, something you wear on your arm during sleep, or you never have to wake up at the same time, the Temp Drop V2 is what a lot of fertility educators use with their own clients. So all of these are linked down below. I get a link because I have a YouTube channel, so I earn a small commission if you use that link to buy it. But again, I'm using these products because I think they are genuinely helpful. So let's talk about what your cervix is trying to tell you when something needs attention. Abnormal discharge. Bacterial vaginosis affects roughly 29% of women of reproductive age. It's not an STI, it's a disruption in the vaginal microbiome. A 2019 study in the Science of Translational Medicine found that lactobacillus depleted vaginal environment significantly increases susceptibility to infection, preterm birth, and cervical dysplasia. Your vaginal ecosystem matters enormously. Postcoital bleeding after sex, is not normal and not something to push through. Most commonly, it's cervical ectropion, inner cells that migrate outward and become fragile. Very common in women on hormonal contraceptives or during pregnancy, but it can also indicate dysplasia. It requires evaluation. Pap smears, they save lives. Current ACOG guidelines, a PAP every 3 years starting at 21 or every 5 years with HPV co-testing after 30. A 2020 trial in The Lancet confirmed that primary HPV testing has higher sensitivity for detecting high-grade cervical lesions than cytology alone. Take the co-test when offered. That's the bottom line. I want to close with this. The fact that most women reach adulthood without knowing their cervix changes position throughout their cycle, without ever being taught what a healthy mucus looks like, that is a problem. The solution starts with attention. If you want to start tracking your mucus, your symptoms, your temperature shift, how you feel in each phase, I love keeping a physical journal alongside any app. My favorite is a period tracker journal. This one has a beautiful design and it lasts for 4 years. It has a layout that is so cohesive with daily symptom logs, mood ratings, and flow tracking. A lot of women in our community use it and find it very helpful. 1 or 2 cycles of paying attention will give you more information about your hormonal patterns than most lab panels. So start there. And when something feels off, unusual bleeding, unusual discharge, pain that wasn't there before, please don't wait. Your body is speaking. Be someone who listens. I'm also going to put a few hormone tracking testing kits down in the description box if you're interested in a deeper dive on all of your hormones. This can be really helpful if you want to track your LH, your PGA, your estrogen, your progesterone. You don't need to go to a hormone specialist to simply grab these numbers. I'll list some kits down below that are reliable. If this video helped you, please like and share it with someone that you care about. That lets YouTube know that this is valuable information and passes this message along that we should all already know as women. And if you feel inclined to subscribe, I would genuinely appreciate it. I hope to grow this community and join together in empowering each other in our own health journeys. Comment below one thing that you learned today and one thing that you wish you had learned sooner. I read every single one of your comments. Thank you so much. Take care of yourselves, and I'll see you next time.